Okay, welcome everyone. So happy that you're able to join us today for our seventh session in Coping as a Community, COVID-19, as we have had a few sessions now. We have definitely have been here for our community to talk about stresses and strains of this pandemic. So thank you for coming and joining us. For our new attendees, welcome. I think you'll enjoy our session today. We get to have a panel today of wonderful nurse leaders from our own UC Davis Health System. We have Todd, Aron King, Mark Bowman, and Al Nutt, who are going to be able to join us. We're going to have a few questions to highlight their work in this pandemic. So I hope that you enjoy our time together and the inspiration that I think everyone will be able to partake in. So at this time, I'm going to have each of our guest speakers introduce themselves and say a little bit about their background. We're going to start with Mr. Todd. Carter, welcome.
Thank you very much, Mercedes, and thank you to the Office of Diversity and Inclusion. Very honored to be here, looking across my screen at the other panel presenters. It's a great honor just to be here with them. So like she said, my name is Todd. I'm a bedside nurse at UC Davis Health in the Pediatric ICU in the big house, 10th floor. Another hat that I wear is I'm current president and founder of Capital City Black Nurses Association. We are a nonprofit local chapter of the National Black Nurses Association, which was established back in 1972. There's over 100 chapters throughout the nation. Been very fortunate to begin grassroots movements here in Sacramento area, revolving around health education, health literacy, and supporting our nursing colleagues within the community in the areas of professional development and striving to do better. So thank you for having me.
Thank you, Carter. And we're going to turn it over to Mr. Aron King.
Hello, hi, thank you for coming. My name is Aron King. I am a current student over at Betty Irene School of Nursing. I'm pursuing my graduate degree in leadership. I'm a current assistant manager over on UC Davis Health on the med telemetry floor. Have background in cardiac telemetry and medical ICU. I'm the current secretary of Capital City Black Nurses Association. You heard a little bit about our group from Carter, and I'm very glad to be here speaking.
Thank you so much, Aron. And Mark.
Hello, I am also an employee at UC Davis and a graduate of Betty Irene Moore School of Nursing, Healthcare Leadership, 2014. Currently, I am an assistant nurse manager also in the medical intensive care unit at UC Davis. We are the designated COVID-19 unit. So we, because we pretty much take care of those type of patients anyway, we've had that designation. And I'm very happy and honored to be here.
Thank you, Mark. And Al, if you can introduce yourself.
My name is Al. I am a clinical nurse too at UC Davis. I work also in the medical intensive care unit and feel very, very honored to be here with all of these other amazing individuals as well. Yeah.
Thank you, Al. And so you work on the same unit that Mark does, and you are taking care of you guys are the COVID unit, correct?
Yes, we are.
Yes. Great. Okay, thank you so much. And so we're going to go ahead and get started. I'm going to just have a few questions for you, and we'll go in the same level of presenter, and we'll start with Todd. And Carter, you know, with all the stresses that the pandemic has brought on for everyone globally, we know that stresses are also hitting, you know, the healthcare providers and our health systems. So what stresses are you experiencing?
Yeah, so like many people, you know, nurse, clinical, non-clinical people in the community, your healthcare professionals are stressed out at this time too. I know initially that first 1 to 2 weeks was very unknown for everyone in the community as the shelter in place was put out. My experience being a nurse is a little bit different than the other gentleman here, is that my stresses mostly revolve around my home life. At work, for me, it's pretty much been the same, if not a little bit less stressful as in recent times. Mine revolves around my small children. I have 2 kids under the age of 2. It revolves around my parents who are being impacted by, the economic downturn of the economy currently, and other loved ones I know who are losing jobs, who are falling on hard times because of COVID-19. And as nurses, we see that, bedside, there's a lot that happens, but, COVID-19 is impacting people 24/7, whether they are contracting the disease, whether they know someone who has, or whether they are feeling it outside of the hospital. So my stresses predominantly revolve around the whole holistic side of what's happening to everyone in America right now.
Thank you. And Aron, I'm going to ask you the same question. What stresses are you experiencing as a healthcare provider?
Just pretty much like Carter touched on. I have the same stressors as most other people. I'm dealing with some distance learning with my oldest son. He's in kindergarten, but I'm fortunate enough to have my wife working from home with the children. So I have that. And then just the social distancing with friends and family. I have my grandmother that lives in town. She's 103. And so not being able to like interact and kind of take advantage of the time that I have with her. I'm in school. Most other people I know are in some kind of form of school. And so transition that on to like an online platform has had a few hurdles. I think Betty Irene has done an amazing job facilitating us all. And then just, most nurses were kind of fearful of bringing anything home. I mean, the average person feels that just going to the grocery store. So that is another stressor that I have. Specifically for me, I'm a new manager at UC Davis. And so trying to learn my roles and my responsibilities while also best supporting my team has been a bit of a challenge and a stress for me. But I think I'm doing pretty well.
Thanks, Aron. And Mark, what stresses are you experiencing in the COVID unit as you're in direct line with the patients?
I would say maybe from a leadership standpoint is ensuring that my staff are safe and that they remain safe. Because there is so much that is unknown that can happen, and so many different changes in procedures that occur literally in the first part of this whole situation. We would have policy procedure changes that would happen literally by the hour, where we would be required to do testing in a certain way, and then we get information as more research came through, and more things validated. We would we would have to change our process, our workflow to ensure that we were keeping the community safe. So from that standpoint, that would be the stressors there. And so far as my personal life, I've been nursing for 30 plus years. When I first came into nursing, the major fear was the AIDS epidemic when I first started nursing, and we made it through that. I've also been nursing through all the other past epidemics with SARS and MARS and H1N1 and that sort of thing. So I do have the faith, that we, like all the others, is something that we will work through, but it's something that we have to work together as a community to be successful.
Thank you, Mark. And Al, we're going to ask you the same. What stressors are you experiencing as a healthcare provider?
So my stressors are pretty similar to, echo some of what the other people have said earlier. My concerns with especially being in the COVID unit, and I don't want to bring anything to my parents who are at very high risk already, as well as as a bedside nurse in the hospital working, a lot of my care I strive to deliver the best possible care I can, and that definitely involves doing family-centered care. So just like Mark has said, we've had to be policy changes are constantly coming at us frequently. We're trying to stay up to date on what is our current policy for dealing with these different things, but not having patients having their family with them at the bedside, really impacts me personally and stresses me out, because I just understand how important that component is to have someone there to support you through those difficult times. yeah, that's really my big stressor, especially when I'm in the hospital.
Mhm. Thank you. And I've heard each of you, talk about not the physical fears, but also the psychological, the emotional, and being able to really give that care that you're so used to giving at the bedside, and how we show up in person. And now with all of these restrictions, that just adds more stress to doing your work differently also. So with that, we have spoken so much through these webinars about taking care of ourselves, because we know that toxic stress really goes against our immune system. It doesn't help our immune systems at all. And so we've had guest speakers around wellness and mental health, some techniques on breathing even, because our breath gets so shallow. What are some of the techniques that you use? What tools do you use to take care of yourself? And I'll start with Carter.
So recently, in the last 3 to 4 months, right before the pandemic started, I began running. And I found that that time alone outside of the home, in a safe environment away from people, has became a lot more important during these times. I realized that I've been having a sense of guilt along with not being on the front line, quote unquote, like our brothers and sisters in New York. So being president of Capital City Black Nurses Association, I've kind of dug more into that and seen what other avenues we can explore to give back to the community, to provide resources. If I can't do it by the bedside, maybe getting into the community and providing care from a nursing aspect there helps to alleviate some of the stress as well. So diving back into the work has been another area that's really helped me get through this.
Thank you, Carter. And how about for you, Aron? How do you take care of your holistic health?
Although I should probably be running, I do a lot of journaling. So that is actually one of the assignments that we have in my graduate program, is like a weekly journal. And that's been very, very therapeutic. And I'll probably carry that on after the program. But I also have the benefit of having a professor that reads over it and she makes comments. And so that helps me kind of sort through my thoughts and my feelings. Also, like reading old entries, you could kind of see where you're growing, where your growth is. And that's just been such a good tool to help with this stress right now.
Beautiful. Might be a book, turned into a book later about the pandemic. That'd be great. So Mark, how about for yourself? You've been a seasoned nurse for 30 years. You've gone through so many other viruses and fears in our health system. How do you take care of yourself?
My grandmother used to call me a jack of all trades, master of some. So I run, bike, sail. I bought a used kayak, and I've been able to go out, on the river and other areas to have that time alone space. I was one of the first group who were placed on quarantine. So then during that time, I delved a little more heavily into photography and post-processing of photography. I really like photographing people, freezing time in the moment. So I, focused a lot on that. One of the other areas I like to participate is community work. But the social isolations have put some restrictions, as well as limiting my ability to, what's been limiting my ability for that is that I've been wanting to save time to be available for work. Because there have been, certain organizations that I'm interested in. There's a group of chefs that are putting together meals for families. So that was something I would really like to do, because as I said, I'm into, healthful living, whole food eating and that sort of thing. And I have not been able to participate in that, just simply helping to put meals together, that sort of thing. So hopefully as this situation dies down, that's something that I can do.
Great. And Al, how about for you? How do you take care of your stressors and take care of your holistic health?
So for me, it is also a mixture, physical activity. And one really big thing that helps me a lot is just music. I'm hugely into music. Anybody who's talked to me, you can tell pretty quickly, like, I love music. I write music, it helps me, just almost like journaling, except for it's to a little bit of a rhythm. So it kind of helps keep my brain focused there. I am also involved in the relationship-based counsel here at UC Davis. So I do practice mindfulness exercises as well. I am a big believer in, taking that time first thing in the morning, especially to just, sit and meditate and, feel my thoughts and understand what I'm feeling and attune to myself so that I can better attune to others when I do have to go out into the world and provide that care.
Mm-hmm. And does that help with mitigating burnout that is chronic in our healthcare system?
To me, I think that it is instrumental in helping with burnout. Just understanding where you are when you enter into a situation is so much more helpful, mentally where your mental status is, so that when you do feel different things when you are, at work, that you can better then understand why you may be feeling that way, because, you already know that you were not at your best right that morning. Something may be bothering you that's totally unrelated to that situation. So, we speak on having to know where you are before you can attune to others, because the importance of attuning is that it happens whether you realize it or not. So if I go into a situation and my patients can feel how uneasy and nervous I already am, they're going to feed off of that and they're going to feel less, calm. So I try to, really make sure I ground myself and, give them that calm demeanor so that they can feel like, okay, he's got this figured out, everything's okay. So, I believe in mindfulness. It's very, very helpful in my day-to-day.
Definitely. And so I know I've worked with the relationship-based counsel also for the clinicians. So can you say a little bit more about your counsel?
Yeah, so we run several different programs that all Reigniting the Spirit of Caring, See Me as a Person, Leo. They're all programs that are meant to help foster therapeutic relationships between you and your coworkers, you and your patients, and as well as a therapeutic relationship with yourself. So we, hold workshops that basically, show you the importance of all these different things like attuning and wondering, following, holding, and, different techniques to build a therapeutic relationship that a lot of us do instinctually as nurses or other healthcare providers, but may not necessarily think about on the day-to-day or put vocabulary to it. So going through those courses, having some vocabulary and really saying, this is the process I'm going through when I am doing these things, I feel has impacted my practice hugely. And I hear great things from other people who have gone through the program as well, that they feel the same way.
Thank you. And that's what I experienced with all of you and all of our other healthcare providers here at UC Davis Health. The relation-based counsel has just been able to really put forth that therapeutic care for everyone in our community. So my next question for you, thank you all. We see messages every day in our media, on social media, about nurses being called heroes or sheroes. And so how does it feel to be called a hero? And I'm going to pose that to Carter.
I always get an uneasy sense whenever someone refers to me as a hero. Literally 2 days ago, I was pumping gas and a gentleman came over and tapped me on my shoulder and kind of scared me. And he handed me a free meal from a restaurant that was doing curbside pickup. And he said, thank you. And I happened to be in my script. So he said, thank you for your service. And, typically that role is reserved for armed forces and sometimes the police. So for it now to be extended to nurses and physicians and respiratory therapists and all our frontline workers, I think it's a new emotion that we're having to all experience. I definitely do appreciate it. And I mean that we really appreciate the love, and it's came from everywhere. We've gotten so much free food, so many donations, so much, just focus on our everyday. And as Al and Mark will probably talk about, they take care of very sick patients every day of the year, 365, 24/7. So now there's this big shift to highlight that. And I know nursing, the last 14 years we're seen as the most trusted profession every year on the Gallup poll. So this just, again, solidifies where nursing stands in our culture. I hope that moving forward as things, we look towards the future, that people focus that energy towards helping those in need, as we see what this COVID-19 virus is going to do to communities and people who do contract the virus. Give back to people who do need. We are fortunate that we still get to go to work. It may be under very stressful situations, but there is a large demographic of people who are losing access to food, who are losing access to healthcare, who are losing their moral dignity because it's being taken from them by this virus. So I make a call for folks to, always, we appreciate the love, but give it back to the food bank, give it back to a blood drive, donate to organizations in the community like CCBNA, like the ANA, who are going to focus on the greater good of the community as a whole, because nurses are resilient. We know that. We didn't take a class on a pandemic in nursing school, I'll say that, so it is new for us, but we have amazing leaders in our organization here, like Teresa Pack, like Michelle Linenberger, like Emma Blackman, who are helping us along the way. So I ask that those people give back in some way, somehow.
Thanks, Carter. And how about for you, Aron? How do you feel being called a hero, or the profession being called a hero?
Just to piggyback kind of like on what Carter was saying, I mean, I feel around the same way. I'm very appreciative of all the donations. I'm getting text messages, emails, just checking on me and thanking me for my time. And many times I do let them know, I'm not really giving direct patient care. I think we should put a lot more support into other areas, other places that you can help. I mean, something as small as just reaching out to your neighbor in your neighborhoods. A lot of people are changed, like their life has changed around everything going on, like losing jobs, just problems with insurance. They're dealing with distance learning with their children. And so sometimes just, checking in with your neighbors, pull in their garbage cans, something really, really easy just to reach out to your, the people in your community. We do have a lot of communities, primary people of color that have been impacted by this. I mean, they were already living week to week, day to day, and now everything is completely changed. And then trying to juggle that with children being at home. It's just, it's very important to remember all these local community groups that are doing good. I know Mark mentioned the chefs out of Oak Park that are getting all these meals ready for the community. That's all very, very important work. Also supporting your local businesses. A lot of restaurants are really struggling. Many restaurants have been around for years. I think they mentioned, I read an article about the Pancake Circus, which is I think it's been around for like 60 years or something like that, but they're struggling. A lot of businesses are struggling. So just kind of, reach out to those areas because they need your help. We got to think about our community as a whole moving forward, and not just the individuals in the medical field doing our day-to-day job.
Thanks, Aron. And Mark, I'm going to pose the same question to you. How do you feel being recognized as a hero?
Even though I do realize that us as nurses, we are literally putting our lives on the line, I am very, very uncomfortable with that label or tag. I have a hard time walking to work and seeing the signs that, thanks healthcare workers as a hero, because it's just something I do. And that was something that I had to come into grips with. Like I said, earlier, when I first came into nursing, the AIDS epidemic was around, and there were several coworkers or family members who told me that I shouldn't be going into this profession. And I would tell them, no, I know what I'm doing. I want to be able to help people and heal. I've always enjoyed, the whole healing aspect. It started off with animals and it just grew into humans. And that's just a risk that I'm willing to take. And I'm not doing it for the glory or recognition. That being said, we all are humans, and there are people who do require recognition. So I want to put that out there because, we in this small group, we're speaking of ourselves, right? But it is important to, for people who are putting themselves on the line, there are those who do need that recognition. They need that validation, and there's nothing wrong with that. That's just human nature. You just happen to have a group of people now who, don't necessarily need that. And as nurse leaders, and we all are leaders at some level, it's important to recognize those people who do require that recognition and to recognize them. So, you know, we are definitely open for donations. I would just ask that people who are donating just be mindful and check in to see what's really needed. Because oftentimes what happens, it ends up being more of a hindrance, because if we're getting 60 pizzas for 12 people, then we have to figure out what to do with those 60 pizzas. It's the same with people who donate, you know, clothing. If you donate a ton of clothing to a clothing bank, then they're spending a lot of time sorting out all that extra clothing, and which takes away the time that they need to send that clothing out. And it's the same for foods. You know, that's oftentimes the people will ask, or organizations will ask for non-perishables. You say, okay, they'll get a ton of perishable foods that could make someone sick. So that's something you have to be mindful of. I first realized that when when Ethiopia was being helped during the famine, and you have a nation that is lactose intolerant, and they had tons and tons of powdered milk delivered. So the donors' hearts were in the right place, but they weren't very mindful of, you know, how they were donating. So that's the only request I have, and it is very appreciative. Or, you know, we appreciate donations and thank yous and that sort of thing. It's just not my space.
Thank you, Mark. And Al, how do you feel about being called a hero?
Well, similarly, I feel really uneasy when I hear it initially, just because, you know, this is something I do every day already, not for the recognition to be called a hero. You know, it's not like I'm looking for somebody to recognize me putting myself into these situations, because this is what I've chosen. And, you know, I'm still going to do it whether somebody says now you're a hero for doing it or not. And, you know, I think that that idea of being a hero, it can, you know, go so much wider than just us that are there right in the front lines, you know, dealing with it. You know, there's tons of things, like everybody has been mentioning earlier, that people could be doing that, you know, makes you just as a hero as well. You know, whether it's, you know, donating blood to help people that may need blood at this time right now, or, you know, doing some small kind of act of kindness for maybe you know, somebody who can't cook for themselves right now at this point in time, or have access to certain, you know, materials that you may have some access to. You can be a hero in that person's life just by, you know, helping them out in that aspect right there. So I don't really like the tag a hero, because, you know, I am very proud to be a nurse, but not for the reasoning that that kind of hero tagline has been attached to. You know?
Mm-hmm.
So, yeah.
Yeah, no, and even, you know, the definitions, our friend Jim in the chat said the definition of a hero is a person admired for achievements and noble qualities, one who shows great courage. And so everyone thanks everyone for all the work that you're doing. And as Carter had stated, you know, the hero term has always been used for veterans and folks at war. And so we do have veterans on the line. And so we thank them for their service. And really, you know, we're all in this together and really wanting to support each other. So thank you each and every one for that information. I just wanted to round back. Aron had made mention to the pandemic and how it's affected our impoverished populations, and definitely our populations of color, such as African Americans and Latinos across our nation. Here in California, the number is really bad for the Latino population, and our African American population across the nation is really highly represented in deaths and in contracting the COVID virus. So the Office for Health Equity, Diversity, and Inclusion has put together another webinar specifically for our African American population, which will be on May 14th. We will send everybody on this webinar that information. You'll be able to see it from the comforts of your home, but we have garnered our specialists and doctors and nurses on a panel to be able to talk about those health disparities in our community. So our office is working feverishly to inform and bring those numbers to the forefront so that we as community members can help those who truly need that. So thank you. In addition to this webinar for coping as a community is strength, inspiration, and hope. And I hope for our attendees that you can see the strength and inspiration of these frontline workers and our healthcare providers here at the health system. And the hope component, I want to ask our panelists about what gives you hope in this pandemic. And so I'm going to pose that to Carter first.
Thanks, Mercedes. So I've reached out to a couple of nurse leaders in the health system, and I was connected with Alex Depew, who is a clinical nurse champion and nurse leader in our emergency department. And she's written up a nice excerpt of her experience fighting on the front lines of COVID-19. And I think her essay speaks exactly to the hope of in the aspect of a nurse. So from her words, working in an emergency department is rewarding, yet demanding and unpredictable. Tonight, will I have to race up to the OR to have a patient who has been injured critically, or will I have to have hear the howling of a father crying at his son's bedside after he was killed from a devastating car crash? Each shift is unique, and we in the ED must be prepared for anything. Now imagine working in this environment during a global pandemic, where a novel virus is seeping through your community, and there are more questions than answers. You don't have the ability to work from home. The doors of the ED never close. You are an essential on the front line. As protocols are constantly changing day to day, hour by hour, I wonder which workflows have changed since my last shift. I'm heartbroken listening to the firsthand accounts from our peers in New York who are facing grueling and exhausting working conditions. I hear the fear in my coworkers' voice when they ask, will we have enough ventilators and PAPRs? Will we be able to get tested for antibodies? And when I hear that 944 shortness of breath in the Charlie 1 now, and CPR in recess room 2 paged overhead, my chest tightens despite having seen and treated these clinical scenarios hundreds of times. We must now remember to pause and change our way of thinking, taking every measure into account to avoid having to choose between our safety and the safety of our patients. This experience has been challenging, with terms like social distancing, shelter in place, becoming a part of our everyday banter. We are witnessing our societal norms change right before our eyes. This was not something that nursing school could have prepared me for. Amongst all these emotions, the greatest one I feel is pride. I am proud to be a member of this department. I'm proud of my coworkers who report to work every day for the unimaginable, who take care of the sickest members of our community and then have the strength to return home to care for their families. I'm proud to live in Sacramento, where community members and local businesses have flooded our staff with well wishes, overwhelming support, and donations. I'm proud to be on the front line. That was words from Alex, and I think that resonates with a lot of the staff here at UC Davis and a lot of the nurses overall. This is an opportunity of growth for the healthcare industry and people as a whole. We've all been forced to take a pause. We've all been forced to understand how interconnected everyone is, from our neighborhoods to our organizations, and we really do depend on each other. This is the time for us to kind of gauge what's important in our life, and it's been really beneficial for me to have that time with my family, to meet amazing other nurse leaders like Mark and Al. I appreciate you, Mercedes, for putting this together. And there's been a lot of micro positive events that are beginning to add up, and they're beginning to outweigh the negatives of the COVID-19 virus. And I feel like we're close. I feel like here in California, we've done an amazing job. I know you talked about the mortality rate in the African-American community. Initially, we were over 50% of the deaths related to COVID-19, and that's atrocious. And then you look in the demographics here in Sacramento, and we were nowhere near that. And I felt really proud to be in Sacramento, to be a nurse leader in the community, and to be a part of an organization that is taking part in initiatives like this and connecting all the leaders. So I have hope that nursing will be stronger after this, that our communities will be stronger after this, because we've realized that we need each other. and that we depend on each other, no matter if you're in IT, if you are a stay-at-home parent, whether you're a teacher. I think everyone has been elevated at this time. Once we get through it, we can be stronger.
Oh, Mercedes, your volume's off for me.
Sorry.
There you
Sorry. Thank you. We're going to go to Aron and ask about your experiences of hope during the pandemic.
Oh, sorry. So yeah, similar to what Carter was saying, you're seeing all these micro examples of like positive hope as far as interactions with nurse. I see a lot with my staff, whereas whether it's switching assignments, I have a few members of my staff that are pregnant, and so in our unit, I know there's been times where we get like maybe a rule out patient, which is, you know, they're thinking that may have, and the test is pending for like a COVID patient. And I've had them switch assignments to kind of go out of their way to help each other out. I've seen it outside where I've just witnessed, like in my neighborhood. I just remember on Easter, my neighbor texted us and was like, look out front. And they had put all these Easter eggs out for our children. Just because I had mentioned not being able to be, you know, with our family, which is, you know, was a tradition for a long time. So it's just like us reaching back and helping our neighbor, and not always knowing that you would get something back. You know, I feel like there's all these little acts of kindness that you're seeing really shine through during this time. So yeah.
Thank you. That was so kind of your neighbors. In addition to, I think I'm reflecting also on what Carter had offered about how horrible this pandemic is, but so thankful to be in California. So thankful to be having the leaders in our government that had acted as quickly as they did. And then our leaders for our UC Davis campus and health system, and how they've enacted their long hours of work to ensure the safety of our entire campus. And that brings hope to me. So let's move over to Mark. Mark, what has inspired you and brings you hope during this pandemic in your work?
A couple of things come to mind. First, the strength of my coworkers. We are in the same situation where we have coworkers that are pregnant, and my staff has just been outstanding with their willingness to change assignments, which can be difficult, you know, for many reasons. So oftentimes we'll, you know, make assignment changes, and, you know, we have a lot of new nurses that are new and had never seen a pandemic before, or something that is life-threatening that can be life-threatening, you know, for themselves. And yet they're still in there. You know, we're not getting the unexpected amount of sick calls. We have people who are signing up for overtime, and that's very inspiring for me. One of the other aspects is seeing patients recover, the strength of our medical system. You know, this is we are seeing a lot of people recover, people who are very, very sick, are doing well, just like the very first patient we had. She's at home, hopefully playing with her children, and probably not working, but she's, you know, back to health. So that's very hopeful and inspiring to me.
Thank you, Mark. And Al, how about you? What gives you hope in the work that you do during this pandemic?
So I feel like I'm echoing a few people once again, being in the fourth slot, but my coworkers, man, they are amazing people. Just like Mark has mentioned, you know, people switching assignments. Nobody seems unwilling or like they don't want to take the COVID patients. They actually seem like patients people are almost drawn to, because they say, well, this is an opportunity for me to learn. This is an opportunity for me to help this person in this situation, despite the fact that, you know, halfway through the day, you may get, you know, notified that now your policy for how we're dealing with this has changed, and we're going to go back and do it differently now at this point. You know, people are just being very flexible and willing to learn, even in this, despite of being in these critical situations that we're in. I'm, training a new nurse right now. And one thing that really inspires me is just like his, vigor for learning, despite, like I say, it's this way one day and the next day it's different, that's super confusing when you're brand new trying to learn how to do, something new. So, him being there and not giving up and still, not getting frustrated in those situations, like inspires me to say, I know what I'm doing already. Why should I be frustrated right now? Let me just take the time and, make sure that I'm giving these patients what they deserve, which is that quality care, so, looking to our newer nurses coming in, inspiring me, and my coworkers also inspiring me.
Beautiful. So there's been a consistent theme of teamwork and being able to lean on each other and being able to really rely on those you're working with. And it really goes back to what you're talking about, Al, about your relationship-based counsel that we practice here at the UC Davis Health System. And part of that is being able to get proximate with people and being able to share as we're doing right now. And so the Office for Health Equity, Diversity, Inclusion are bringing our toolbox over to the relationship-based counsel and being able to provide community healing circles. And the circle work that we have been doing for the last 2 years is to be able to provide a safe space for all of us to get proximate, to get into each other's shoes, and be that support that all of us have just discussed and how we experience that in all aspects of our lives, but specifically in the workforce. Here at the health system, we spend more time on the workforce with the people we work with than we do at our own homes. And part of those community circles, Aron and Carter were able to participate in. And so I was just going to ask you, Carter, what was your experience with our healing circle?
It was extremely positive. That was my first time meeting you, Mercedes, and I remember Aron and I stayed over after, and we spent a good amount of time debriefing on how amazing it was. Having the opportunity to work for a big health system like this is awesome because you meet so many different types of people. I mean, in my group, I was the only clinical, or myself and one other, I think, was only clinical provider, but there was IT and other people that were not necessarily in my shoes or completely understood where I was coming from. So to have that space to be able to learn from them and listen and provide support, it was really uplifting. And the idea of being able to incorporate community, to be able to be more intimate with the surrounding Oak Park and all those within the health system was really exciting to me. I was really happy that Mercedes chose us to embark on this new journey with. And I think where the really money is going to be made is from the physician, nurse, RT, environmental services, the community member, to have everyone in the same space being able to understand and speak together is going to be huge.
Thank you, Carter. And that's our hope, is that we get to cross-pollinate with each other because we get too isolated in our own work. And our community healing circles are based on community health, which is using a framework from public health so that we're able to really be in community. And as we all discussed, and you had discussed with neighbors, being able to reach out to each other, let's do that in our own campuses for each other too. So Aron, how about you? What was your experience with our healing circles?
Yeah, I believe the healing circle that I attended, there were some members of the community, not so much medical workers that were there. And it was really nice. I haven't ever done anything like that. It's very therapeutic to hold these conversations in like a non-judgmental space where it was more you as a listener focusing in and listening to someone without in the back of your mind preparing yourself some way to respond. You were just open just to listen with no response, which was really great. Just so that you could really understand where the person was coming from and their feelings. You were able to be honest in your feelings and your experiences. I know oftentimes, especially like now with everything going on, you try to put this front up, where I speak to my wife or family members and they're concerned and, oh no, I'm fine. But in reality, there are concerns that I have, but you try to be strong as, a partner in my relationship, my wife, I try to be strong for her, and so that she doesn't, have any times that she's worried about me, that she could just worry about the children, that we're working together to provide for our family. I know personally the session that I attended, there was a lady that worked, I believe, in palliative care. And after hearing everyone's stories before we left, she just took the time to sing, which was very just authentic. You know, she said she often sings for her palliative care patients, and she wanted to share a song with us. And, you know, it was just a great experience all around.
Thank you. And so that experience to be able to be proximate with each other and get in each other's shoes is really that community aspect. Once again, we have to build in behaviors to build community so that we have stronger immunity from any viruses. And so the more isolated we get, then the stressors come, and then the stressors, as you were saying, you put up this front, it doesn't help our health. And so those stressors decline our immune system, which makes us perfect hosts for viruses such as COVID. So if we can implement this system-wide, and we'll be able to provide these community circles beginning May 7th. And so we'll be utilizing the circle practices for our healthcare providers during this COVID season. So at this point in time, we're going to open up the chat. My team and I, at this point, think we have a good amount of attendees who might have questions for our panelists that we'll be able to vet for our panelists. So if you are guided to do so, you can give us in the chats. And at this point, gentlemen, wanting to also, you had made mention about your families, and we had talked about the stressors that you're experiencing, but you know, what are you seeing with your own families or your colleagues' families? How are families handling this, and how can a community handle and support families at this time? And I'll start with Mark this time.
Education. I, have experienced, a lot of stress through family members, and so far what I have done, would seem successful, is just kind of gear them in the right direction, and so far as to where to get accurate resources for information. We, in our household, because the news, just the normal news, CNN and all the other places, have just gotten so opinionated and just tend to sensationalize and overblow everything. We just really stopped watching the majority of the news. We'll watch PBS NewsHour, and that's pretty much it. And we just seek out the information, the real information that's out there. So I direct questions to CDC website, WHO, those sort of reputable places to actually get information. For instance, I had a family, when I was placed on quarantine for 14 days, a family member texted me and said that a lawyer of hers told her that COVID-19 now lasts for 24 days. Why are you only on quarantine for 14 days? And I asked, well, where'd you get this information? And the site sounded legitimate. It had science something in it. So I had to go 3 levels deep to find out that it was one family in China where a family member got infected, and the other family member wasn't infected for another 24 days. So somehow they came to the conclusion that it lasts for 24 days. And so there was a lot of feedback about that was posted with that article, and there was no rationale for their science, or whoever wrote the article science. They didn't provide any legitimate feedback. So that was something that I was able to show this family member, hey, you have to be careful what you read, and sometimes you have to take the extra time. If you're concerned for your life, it's worth the extra 20 minutes that I took to dig a little deeper to, find out the source of that information. So that's pretty much how we handle that.
Mm-hmm. And how about for Aron, Carter, and Al? Either one of you want to chime in about how to best support families during this time of the pandemic?
I think we just, we let everyone know that they can do their best, that we are all trying and learning and going through this for the first time, whether it be teaching your kids math at home, whether it be being afraid or for the first time having to wear a mask out in public, whether it be trying to digest all of the information that's coming down the stream, is to give the grace to our coworkers and our family members to just do your best and to have good faith in everybody that we all are in this together, that no one, for the most part, is an expert yet. We're all learning. And as it's been talked about, the information is evolving. Routinely, it's evolving. So keeping that good faith in folks. I know I debrief with my mom after work. I think I call her more now than I did before because, you know, just keeping people current and checking in on folks. I know everyone's been using FaceTime and Zoom at a higher clip now, and just giving people that grace.
Beautiful. Thank you, Carter. Aron or Al?
I just wanted to first mention that I check in with my mom every day, Carter, but
I know your mom thanks you.
yeah. She's probably tired of me calling. But I think just to understand, like he said, that a lot of things are changing. I know personally when everything started and as appointments and events, conferences, concerts, all these start to get canceled. I really focus in on sticking to a calendar and having a plan. And now I just understand that sometimes I can only live by the week, you know, and things are constantly changing. You know, I know a lot of people are worried about working. They're worried about when school going to start again. But I think just to slow everything down and kind of focus on your family and take this time to enjoy with your kids. I know that many times we get into this routine where, you know, I work in this time, then I'm home, then take your son to school. And we're just always so busy. And I feel like this has given me the opportunity to stay home and spend some time with my children. We put together a sandbox, like just things that we normally don't have time for. And just to really appreciate the time, you know, appreciate the time you have with your kids, with your family, with your loved ones and your friends.
Beautiful. Al?
Yeah, so like many other people, same thing. I try to, you know, really keep my channels of communication open and just, you know, be there for anyone who really has something that they want to ask me about or, you know, get my opinion on something. Not that I'm a, you know, expert on the subject, but just like Mark was saying, you know, relevant places to find your information that are, you know, credible, that you can trust that information when you get it and not just believe the first thing that pops up on Google, you know. But I really try to make sure that I keep that communication open. I know one of the stressors for my family is just like, am I okay? What's going on with me? You know, am I sitting at home and nobody knows what's going on with me? You know, and so I really try to keep that channel open and let them know, hey, you know, I'm doing good today. You know, I went into work, you know, it's going great. You know, how are you guys doing? And just making sure everybody's feeling, you know, as okay as they can right now at this point in time.
Thank you. And so we do have some comments and some questions in the chat, and I'm going to take Gabe's question. What resources do you each of you recommend we can consult to follow the rules and guidelines as they change and are updated? Mask wearing, self-care, protection, and all of those. So as you think about that, Gabe, I'm going to just make sure that we have our resources from the former weeks that we're going to be giving through the survey that we'll send everybody on this chat, because we definitely gave quite a bit of tools on self-care. So if any of the panelists have a resource on staying up on those current guidelines. Mark, you had mentioned the CDC website, which is the Centers for Disease Control and Prevention. In healthcare, everybody uses so many acronyms. Folks don't always know what those are.
Yes.
The World Health Organization, the WHO. I know the California Department of Public Health is very informative also. But if anybody else has any other resources, please chime in.
I know professionally, being a part of National Black Nurses Association, they've put out a lot of really good resources and up-to-date information, expert panels. Mm-hmm. So I would say tap into whatever your profession is, your outside groups. There's a lot of information through the American Nurses Association. I'm sure that physicians have those types of groups as well. And it's a lot of really smart people who are spending the time and energy to put this together. And like we said, spend the time to get your information from somewhere that's reputable, whether that's the CDC. I feel like the state of California is a good place to visit. I know Gavin Newsom has been putting out weekly pressers and keeping people up to date. I think Sac County website has a live tick of the current COVID cases, current recommendations as they roll out. But for very basics, anything with a .gov would be likely a good place to start for the most part.
Wonderful. Thank you, Todd. So in our last few minutes, I want to just ask the panel, just for one statement or word of inspiration for our attendees. And I'll start with Al. Do you have a word or statement of inspiration for our attendees?
One word that I like to always use when I do my mindfulness classes is gratitude. I have just so much gratitude for, what I'm able to do for people to be in this position. I feel so gracious.
Beautiful. Thank you, Al. How about you, Mark?
I would just say to be mindful of what you say and do. Do your best to remain true to yourself and who you are.
Thank you. Todd?
I just appreciate being able to be in this space, being able to be a nurse during this time and rise to the occasion. I appreciate working alongside great people like you all and being a part of great organizations, having my health, my family's health, still having a career. So I'm really appreciative of being in my space where I'm at.
Thank you. And how about for you, Aron?
I say, overall, I like to say, just check on your people. That's what I like to say, because I feel like when I say people, it covers so many levels: your coworkers, your neighbors, your mailman, your friends, your family. I've been taking the time over the last couple of weeks just to reach out to someone I haven't talked to in a while. Just send a text, just like, how are you doing? What's going on with you? How are you? Because I think so many times you focus so much on what you're doing in your own space that you don't think about those other people that are out there. And, there's a lot of stress out there, and people are stressing for so many different reasons. Mm-hmm. And so just to reach out and just be authentic and, show that you care, or that someone cares about them, that's what I like to go for it with.
Gentlemen, this concludes our time. It's been a pleasure to be able to work with you, serve with you, and we'll continue to do so with our community healing circles, which next week, Dr. Henry Todd will be our guest speaker on that. Thank you everyone for your attention and all of your love.